Okay. So score 0 and 1 we count as not lame, and score 2 and 3 we count as lame. So what score is this cow likely to be? So she's likely to be a score 2 cow because she's not lame enough to have her speed affected. And let's say that this is her lesion, a digital dermatitis lesion. A lot of the most common cause of lameness in the UK, and I'm guessing it's the same in Portugal, but the most common cause of lameness is digital dermatitis. It doesn't necessarily cause severe lameness, although it often can do. But these cows will be a score 1 or a score 2 cow. So score 1 being that we can't tell which foot they're lame on. Score 2 being we can tell which foot they're lame on. So the picture I showed you before is probably a score 2 cow and probably got digital dermatitis. So where is she going to be in the herd? Is she going to be at the front? Is she going to be in the middle? Or is she going to be at the back? Now, if we ask this question to a lot of farmers, they would say, she'll be at the back, but she won't. She could be anywhere in the herd. The whole point about a score 2 cow is that her speed is not affected and she can still remain hidden in the herd. And this is a phenomenon which gives us a lot of problems when dealing with lame cows and trying to find lame cows to treat early on. Cows, they're prey animals, and they have a very strong ability to mask lameness. So a lot of cows that will be having pain in their foot, we can't even tell which foot they're lame on. So they'll be score 1 cows, or even score 0 cows. Score 2 cow, if we look for them carefully, we can identify that they are lame on one leg or one or more leg. So she's lost her ability to mask it to some extent, but she can still mask the lameness by hiding within the herd because her speed is not affected. And that gives us a lot of challenge because if we don't spot these cows, they're forgotten, and also we lose the best opportunity for treating them, which is going to give us the best chance of a treatment success. So what can we do to try and help spot these lame cows early on? And the answer is really to use mobility scoring. And it's a common thing that I hear from farmers that I deal with is they'll say, well, I don't need to mobility score. I know my cows well. I see them every day when I milk my cows, and I know the lame cows. And in actual fact, they don't know their lame cows. They know their score 3 cows because they're the ones that have lost their ability to mask lameness. They're the ones at the back of the herd. They're the ones that will be coming into the parlour last. They'll be the ones that come into the milking parlour and perhaps hold up a foot. And they'll be the ones that have physical changes in the foot. So maybe a large swollen foot, for example. They're not the cows that we need to try and spot. The cows that we need to try and spot are the score 2 cows. And you don't need to be an expert to spot score 2 cows, but you do need to look for them. And that's what mobility scoring is all about. It's a discipline of actually spending the time as a separate job to look for the score 2 cows. Because if you look for them, you'll see them. If you don't look for them, they're ignored. So I've put on this screen here the percentage of cows that fall in the different categories. And this is recent UK data. So again, I don't know how Portugal would compare. This is just adult dairy cows. And 32% of adult dairy cows in the UK at any one point in time, at any one moment in time, are lame. 68% are scored 0 and 1, and we class those as not lame. Some of those will have mild lesions. 32% are lame. In other words, showing signs of lameness that is detectable if we look. Now, the majority of those will be score 2 cows rather than score 3 cows, and around about 8.5% of cows will be score 3, and they'll be the ones that are slower than normal, so their speed is now affected. Now, if we ask farmers who their lame cows are, or what proportion of their herd is lame, they usually vastly underestimate the proportion, and they often say perhaps around about 5 or 10%. And reason for that is not because farmers are lying to us. It's not because they're being dishonest. It's not because they're trying to hide their lameness. It's probably because they will know their score 3 cows. And so if you ask a farmer who their lame cows are, they can think of their score 3 cows, but they don't know who their score 2 cows are because they've never looked for them. So they vastly underestimate their lameness, and they only really count the score 3 cows. In other words, those that are lame enough that their speed is affected. When actually we stand as a vet side by side with our farm clients and watch the cows walking past, then they can find the score 2 cows just as well as we can as vets. And the comment that I often hear from farmers when doing this is that they turn to me and they say, "Oh wow, Owen, I never realized I had as many lame cows." So it's all about raising awareness, and it's the starting point really for any lameness intervention. Why should a farmer want to take time and effort in reducing lameness if they don't realize that they have a lameness issue? So that's the difference between the perceived lameness, in other words, the amount of lameness that farmers think they have, and the actual amount of lameness. And for most farms, that's a big gap. So the question to ask is, has anyone done a herd mobility score? Has anyone actually looked for the score 2 cows in your herd? If they have done a herd mobility score, how accurate was it? How was it done? Was it done by someone who's been trained in mobility scoring? Was it done by someone who was dedicating a specific time and place in order to do it? Or was it done just as part of another job, for example, at the same time as body condition scoring, or at the same time as 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 another task? If mobility scoring is not done as a separate task, then it will not be done properly, and score 2 cows will be underestimated. So if a herd mobility score has been done, what were the results? And then the next question, obviously, from that is, well, what's the impact of that? If you have 32% of your herd who are lame, what is that costing? Now, often farmers will say, what does it cost us mobility score a herd? Well, it might cost in the UK around about €100 for a 200, 300 cow herd to do a proper herd mobility score. But the cost of the lame cows is a lot higher than that. So I've tried to estimate this um, in a simple way. And rather than estimating the cost of lameness in a cost per case, it's probably more useful for most people to express the cost of lameness in a cost per lame cow per day. And the average lame cow, bearing in mind there is a range because the more severely lame she is, the more costly it will be. The average lame cow, in other words, score 2 and score 3 cows, will be costing €2.50 per day for every day that she's lame. And that cost is made up of 4 principal reasons. The biggest cost is actually the effect on her fertility and her reduced fertility for being lame. And the fertility is reduced because lame cows show estrus less well, so they don't stand to be mounted when they're on heat. But also, if they're more severely lame, then it will affect their cyclicity. Following on from the reduced fertility, the other costs are the decreased milk yield and also the increased risk of a premature cull. And of course, a lot of these cows that are lame, if they are culled, they're culled as a low value cull because they have lost weight. The smaller amount, the fourth element of the cost of lameness, is down to the treatment and labour costs. And often again, there's a misconception here. If we ask farmers what is costing them for lameness, or why is lameness costing, then they will think of the things that they have to pay for. And of course, the things they have to pay for are treatment costs, vet time, and they'll be familiar with their own time that it takes to treat a lame cow. But they massively underestimate the cost of lameness because they don't necessarily think of the fact that every lame cow, for every day that she's lame, she'll be less likely to get in calf, and she has an increased risk of being culled, and she'll be producing less milk compared to her potential. So in the UK, a typical herd size, dairy herd size, would be 200 cows, 200 adult cows. Our typical yields are 8,000 or 8,500 litres per year. So for a typical 200 cow herd with a typical lame cow prevalence of 32%, just under a third of the herd are score 2 and 3, that is costing €160 per day, or 58,500 euros per year, or 3.4 cents per litre. It's a huge, huge cost. It's massively underestimated as well. Now, I would be foolish as a vet to ever promise a farm to reduce this cost to zero, because that would mean that I would have to help that farmer reduce their lameness to zero, and that's probably an unachievable target. But it does give a large budget, a large amount of money um, to work with, even if we promise a very modest reduction of lameness. So even if we can reduce the lameness to 20% from its initial level of 30% or 32%, then we can be saving in the region of €20,000 for a typical herd. And as long as they're not spending more than €20,000 on mobility scoring and any intervention they might want to make to reduce lameness, then they will be in profit. They will make money on the lameness reduction. So the cost of lameness isn't necessarily the most important motivating factor for everyone, and I'll look at different motivating factors later on tonight. But if we ignore the cost of lameness and don't forget that most farmers can't estimate the cost of lameness, then we are ignoring a very important motivating factor for most farms who at the end of the day are trying to run a business. So, having opened up the conversation about lameness, about the fact that it's easy to underestimate the number of lame cows in a herd, about the fact that it's easy to underestimate the cost of lameness, then it's worthwhile opening up the conversation to discuss specific lesions and ask questions. Lift cows' feet and ask the farmers, what do they think the lesions are? You know, what causes this lesion? This is a digital dermatitis lesion. I'm not sure. In Portugal, you may call this mortellaro disease or hairy warts, which is the North American terminology. We call it digital dermatitis caused by treponemes. Some farmers understand it well, but a lot of farmers don't. A lot of farmers really welcome that discussion on, you know, where those bugs, where those bacteria live, the fact, and how does it spread, and why do some cows get it and some cows don't, and what's the best way to treat it, and what's the best way to prevent it, and how can I stop it happening in other herds, and what's a reasonable level to accept? These are all kind of questions which, if you open up the conversation, you will find that farmers will be asking you these questions and really have their interest stimulated. So this is the starting point. It's grabbing the farmer's attention, and hopefully you might now have the farmer's attention just by asking some questions and allowing them to ask you questions. You might also have, by asking questions, have stimulated him or her to begin coming up with some of their own solutions, and definitely asking their own questions. And also, by having this conversation, you might now have a better idea of your client's knowledge gaps, their motivations, how much importance they put on lameness, what they feel is important about lameness, and what their priorities are. So that's our starting point. And that takes me to the end of the first part of the presentation. I'm just looking in the chat box. I've not had any questions yet. So if you want to ask any questions at this stage, please feel free to type something in the chat box. Anna, could I just ask you to type something just to check that the sound is good and that you can hear hear what I'm saying and see the slides okay? If you could just perhaps write something in the chat box, that would help me just to get a little bit of feedback to know that everyone can hear. Okay, thank you. It says everything is wonderful. That's good. Thank you very much. So I'll move on. Looking at the next part, really, which is trying to put lameness management into practice, and I'm going to talk about the Healthy Feet program that we use in the UK, which has been developed over several years, and I'll share with you some of the difficulties that we've had with the Healthy Feet program, but also some of the successes and some of our learning points. And basically, the Healthy Feet program is a model for an intervention program to help farmers reduce lameness. But before I launch into that, I just want to make sure that I want to check really that we're talking the same language. So I'm going to show you some pictures of some of the common lesions that we see in the UK, and I just want to make sure that what I call it, you understand and use the same words. So this is a cow with digital dermatitis. This is a very active lesion here, and this is a more chronic lesion, but nevertheless, this is a digital dermatitis lesion. Like I say, you may know that as mortellaro. Okay, this is a cow with sole hemorrhage in the typical site over the back of the sole area, which is a typical pressure point, and that, when it becomes more severe, becomes a sole ulcer. So this is a sole ulcer, and then the fourth lesion, the important lesions, is a white line disease. So of the lameness in the UK, 70% is caused by either digital dermatitis, sole ulcer and sole bruising, or white line disease. The other 30 odd percent, or the other third of lameness are caused by other things. For example, foul, or you may know that as foot rot. Okay, so that was just to establish that we're on the same page and we're talking the same language. And by the way, I also just want to check also, this is a sole hemorrhage. Sometimes I would call that a sole bruise. It's the same, a bruise or hemorrhage. It just means blood in the sole horn. This used to be called laminitis. It's not a term that not a word we encourage to be used to describe this lesion in the UK. It's quite an old-fashioned term. Laminitis can occur in cows, but it isn't the cause of this lesion. You do sometimes see it in textbooks, even recent textbooks, but it's not a term we encourage. We use the word sole bruising or sole hemorrhage. And this is a sole bruise in the typical site beneath the pressure point at the back of the pedal bone. And I just want to show you some diagrams to show what's happening here. This is the corium or the quick, which produces new sole horn. Layers of sole horn are laid down here. And when there is bruising or trauma to the quick, and it's usually here where my arrow is, then you'll see blood incorporated into the horn. There's a little line of blood here. Okay, and that's a very mild bruise. And when it becomes more severe, that is the result that results in a sole ulcer. Okay, now something that has changed a lot recently in our understanding of sole ulcers and risk factors for sole ulcers is the digital cushion or the fat pad. So when I was at vet school, which is 25 years ago now, if I was asked to label this diagram and put an arrow to where the fat pad is, I would have put my arrow to here. I just knew it as a gristle of fat in the bulbs of the heel, and if I was asked to describe what the function of the fat pad was, I wouldn't have really been able to say anything. But actually, the fat pad, it turns out, is a very important aspect of lameness. So if you look at the foot dissected in a different direction, then the fat pad actually has three cushions or pillows. The digital cushion, by the way, is the same as fat pad. Three pillows which run underneath the pedal bone, and these have a very important shock absorbing function. So I think the next picture here shows a computerized scan, a CT scan, computerized tomography scan of the fat pad. So it shows how the fat pad or digital cushion runs under the pedal bone, not all the way to the toe, but it runs at least halfway under the pedal bone. I think the next picture shows those three pillows of fat, or three pillows of digital cushion. And their role of these digital cushion is to act as a shock absorbers, and the metaphor that I use often to describe this is like the air pockets in air cushioned soles of trainers. So if you think about your running shoes, often running shoes have got air air pockets. Nike shoes have got their Nike Air shoes have got their air pockets, and they act as shock absorbers. And the fat pad has a similar role. So the implication of that is important because it links nutrition with lameness in a better way than we've ever been able to explain how nutrition links with lameness previously. So the old-fashioned story was all about laminitis, cows fed too much protein, or cows becoming acidotic, and then they had toxins in the feet and they got laminitis and they went lame. Well, that's now old news. That's not really what happens. What happens is anything that makes cows go thin, so that could be acidosis, quite commonly it's acidosis, or maybe it's just underfeeding, or maybe it's a protein energy imbalance, whatever. There's lots of reasons why cows go thin, but for whatever reason the cows go thin, it increases their risk of lameness, and in particular clawhorn lesions such as sole bruising, sole ulcer, and white line disease. So thin cows go lame, and of course when a cow has become lame, she also tends to go thin. So that's just a little bit of background. I wanted just to check that we're all on the same page on that, because it's not always common knowledge to everyone that that's the story. It's fairly recent research, but it's robust research. It's been repeated in various countries, and because the fat pad is reasonably easy to measure using ultrasonography, then there has been quite a lot of work done in this area looking at thickness of fat pad and what effect that has on lameness. So thin cows go lame, and it's all to do with the fat pad, and that is really the link between nutrition and lameness, or the main link between nutrition and lameness. So, okay, having got that out of the way and having done that preamble, and now I would like to introduce the Healthy Feet program and what it's about, so and how it works. So the Healthy Feet program stemmed from a research project at Bristol University, which is one of the university veterinary schools in the UK, and it started in 2002 as something called the Tubney Healthy Feet Project. And this was a project looking at working with 75 dairy farms and trying to educate, bring their knowledge of lameness to a higher level, educate the farmers, and what worked and what didn't work in terms of trying to help farmers reduce lameness. And from that, the Healthy Feet program has been developed. So what does the Healthy Feet program look like now? So the Healthy Feet program is supported by a whole load of materials, and it is delivered by trained what we call mobility mentors. So these are predominantly vets, but they are also some foot trimmers and also some farm advisors as well, but predominantly vets. And it's a very structured approach, helping a farmer to first understand their problem, and then establishing what the most effective interventions might be, but then importantly helping the farmer with their motivation to change their behavior and actually put their plan into action. So that's just an example of some of the materials to support it. It would start off, for example, by having a preliminary interview with the farmer, just to try and understand what their own understanding is of their lameness to start off with, and understand what work they've done previously to try and reduce their lameness, for example, what they understand about the costs of lameness, what they understand about the different types of lesions that they see. So it starts with a preliminary interview, and then it moves on to a farm risk assessment, and that's used to develop an action plan, which is prioritized. So it has a process. It has a data review process, which is basically looking at what the lameness level is, and that's done if there's been no mobility scoring done previously, then that's done through doing a herd mobility score. Looking at any foot trimming records if they're available. Sometimes the records are very good and very complete, sometimes they're not. In which case, if there's no foot trimming records, it's useful just to lift some cows' feet that are freshly lame and ask the farmer whether they're the typical things that they see, and get an impression for what the main lesion types are. And it's perfectly possible to do that, to walk onto a farm without any data whatsoever and actually work out what the main lesions are just by lifting some of the lame cows. It's not perfect, but it's a very good starting place, because if you don't know what your lesion types are, then it's very difficult then to work out what the best interventions are going to be. So the next step would be the risk assessment and action plan. So the risk assessment involves using a very detailed checklist to examine all parts of the farm environment, all the management practices, and how they impact on the lameness in the herd. And then working with the farm team to devise interventions which are likely to be useful. And this is done in a facilitation fashion. So rather than the vet writing a report and telling the farmer, this is what you need to do, it's working with the whole farm team. So that would include, for some farms, quite a lot of people. It might be the herds people, it might be the milkers, it might include the tractor drivers. There may be 10 people working on a farm who all need to be brought together, including the foot trimmer, if there's an external foot trimmer, and really facilitating the group, having done the risk assessment, facilitate the group to come up with their own action points. And your job as a mobility mentor is to guide that process. And for sure, it's important to check that the actions that are decided upon are likely to be beneficial. And that's the skill of being a mobility mentor. But it's equally important that those actions come from the team rather than the vet, because it's important that they own the problem and they own their own solution. And all farmers, when this process is done as it should be done, and this is what the training is for mobility mentors, then they will come up with their own solutions, and they will come up with sensible solutions, because if they understand enough about what their problems are, they understand their farms well enough to come up with the sensible solutions. And because they own their solutions, they're more likely to put them into motion, and they're more likely to do them. So that's a key finding of the original research, is that it has to be a facilitated process rather than a top-down approach where the vet tells the farm what to do. So that's the skill of being a mobility mentor, is helping the farm develop their own action plan. Developing an action plan is probably just the beginning, or the end of the beginning, because the next part is to help the farm put it into practice. And as I said earlier, farmers have a lot of things going on. They have a lot of different things they have to prioritize. And lameness, it's too easy for lameness to slip down the list of priorities and be sidelined for other, what the farmer might believe is more urgent tasks. So the follow-up is all about supporting the farmer through the process of making those changes. And even if that involves just regular contact to ask which of the actions have you done? You know, we agreed last week that you would do such and such. How did it go? And again, that is what a lot of the training is for the mobility mentors, to give them the confidence and skills to deal with the knockbacks that are inevitable when working with farmers in this way, and to support the farmers to make the changes. A fundamental process that also occurs throughout the whole program is regular independent mobility scoring. So the mobility scoring is the tool that we use for measuring whether the farm is making improvements or not. So this is an independent herd mobility score, which can be done by the mobility mentor themselves, i.e. the vet, or more often actually now in our practices, our veterinary practices in the UK, it's done by a paraprofessional or a vet tech. So I don't know if that's something that has taken off in Portugal and any of your vet practices, but certainly in the UK, most of our veterinary practices in the UK are specialised between either small animal, i.e. companion animal, dogs and cats, or farm animal or equine. So that's been going on for the past 20 years or so. So if you are a farm vet in the UK, you're a farm vet. You don't see dogs and cats. I don't know whether that's the same in Portugal. You know, the European countries vary a lot in how that works. The next the next change that I'm seeing very quickly is that the farm animal practices, the vet practices that do farm animal work, they're now employing non-vets, so-called vet techs, who are, I guess, like veterinary nurses, but only in the farm animal sector. And they are able to do a lot of the paraprofessional work to relieve some of the pressure from the vets, but also make it cheaper for farmers. So, for example, they will be doing the mobility scoring, because it's cheaper to employ a vet tech to do mobility scoring than it is to employ a vet to do mobility scoring. So I don't know if that's something that you're seeing in Portugal. I'd be interested to know, but it's a really big change in the UK that's happened in the last 5 years, and it's accelerating. So a regular independent mobility score organized by the vet practice or the mobility mentor underpins the whole program, and that's normally done by a vet tech. So it's a step-by-step process. You need to start with a mobility score at the beginning. You do a skills review and really find out what the farmer understands about lameness. You do the risk assessment using a checklist. You agree the actions and come up with a mobility contract, and that's a facilitated process. And then you follow up and review. So that's the step-by-step process. Okay, the next aspect of the Healthy Feet program, which again pulls it together and underpins it, is this concept of 4 success factors for healthy feet. So lameness is a complicated beast. I've just explained the 4 main lesions that we see: digital dermatitis, white line disease, sole ulcer, sole bruising. And of course, the risk factors for something like digital dermatitis are very, very different to the risk factors for sole bruising. And so if a farm has got their main problem as being sole bruising, their interventions and the things they need to do will be very different compared to the farm whose main problem is digital dermatitis. And the 4 success factors for healthy feet are used to try and simplify what is a very complicated disease process. And the 4 success factors are to have a low infection pressure, to have good hoof shape and horn quality, to have low forces on the feet, and that's subdivided into having good cow comfort, which translates as high lying times and low standing times, and good cow flow, which is how cows move around the farm. And I'll look at in a minute. I'll look at each of these success factors in a bit more detail, and I'll explain what's involved with cow flow. And then finally, the 4th one is early detection, prompt, effective treatment. We summarize that, we shorten that to EDPET, E-D-P-E-T, EDPET, early detection, prompt, effective treatment. And that's a success factor on its own. So let's look at each in turn. The Healthy Feet program has a little schematic so that these images and these terms, low infection pressure, good hoof quality, low forces, and EDPET, they're used throughout the program all the time, so that the terms and these images become ingrained in farmers' minds. So let's look at the low infection pressure to start off with. The things that are involved here are, for example, foot bathing, slurry management and hygiene, biosecurity as well, so being careful about bought-in cows, and treating cows before they're introduced to the herd, or perhaps quarantining them. And it's all about reducing the reservoir of infection. And of course, it's important, particularly for the infectious types of lameness, in particular digital dermatitis, which is the most common one, but also foul of the foot, which you also might know as foot rot, and heel erosion, which is also known as slurry heel. Okay, I've just seen someone's put a question that in Portugal you're divided into dairy vets, equine vets, large animal vets, small animal vets, etc. Okay, very few vets doing mixed practice. So similar, that's good to hear. Thank you. So that's low infection pressure, and for example, it would include hygiene of the floors, slatted floors we don't see many of in the UK compared to some other European countries, but it can be a good way of keeping feet clean. But paying attention to hoof hygiene is an important thing for lowering infection pressure. And it also includes foot bathing. And foot bathing, I'm not going to talk about foot bathing today because it's one, other than to mention it, it's almost a webinar in its own right, because there's so much talk about foot bathing. It can be done badly, and that can make digital dermatitis worse, or it can be done well, and we'll leave it there. But foot bathing is an important part of lameness control. But sometimes I think we find that farmers, they think that it's all about foot bathing and nothing else, and if they just foot bath their cows, their lameness will go away. Unfortunately, it's rarely as simple as that. Okay, let's look at the next one, which is good hoof shape and horn quality. It's a bit of a catch-all list. Lots of things come into it. So nutrition comes into this. So apart from avoiding thin cows, biotin supplementation would also be an aspect to be considered. And that's particularly important for hoof strength, and that's important for reducing white line disease. There's reasonable research evidence to show that supplementing cows with biotin reduces white line lesions. So that's about improving the quality of the horn. Breeding is an important factor, and I think there's going to be more that we will learn about breeding and genetics in lameness reduction. For example, I've already mentioned the fat pad, but and I've also already mentioned that thin cows have a less protective fat pad. But there's probably a high genetic component as well to the quality of the fat pad. So, for example, it is likely that different breeds, it hasn't been proven yet, but it's likely that different breeds will have more protective fat pads than other breeds. So, for example, it may be one of the reasons why we see less sole bruising and sole ulcers in Jersey herds. Jersey breed, I don't know whether you have Jerseys, I think you do, Jersey breeds. Jersey herds and in Holstein herds. There's other factors I'm sure that are implicated there, but the fact that Jersey cows, for example, may have a better quality of fat pad than the Holstein cows may be a reason. And then within a breed, there's likely to be genetic components to fat pad, but also other aspects of hoof shape and horn quality, which are important for lameness. Hoof shape is also dependent to some extent on how frequently the cows are trimmed and what the trimming quality is like. So foot checking and foot trimming comes into this. There's a bit of a crossover. So I mentioned about having clean, dry feet is important for reducing infection pressure, but it's also important for improving horn quality. So in the wintertime, when our cows are housed and their feet are wet because they're in slurry, then the horn goes soft, and that causes problems. And in the grazing herds, often the lameness, the peak lameness incidence is in the autumn months when it goes wet and the tracks are very wet and the feet are very soft because they're wet. So drainage and keeping feet dry is important. Maintaining an effective fat pad, that's about body condition score. Making sure that cows don't go thin. Cows are not calved down too thin, and we know it's important to calve cows down so when they calve they're not too fat, because otherwise they become ketotic, they suffer from ketosis. But equally it's important that they're not too thin, because they've got a high risk of lameness, and they mustn't lose weight quickly in early lactation. And then finally, avoiding excessive wear. So it's a bit of a catch-all list, good hoof shape, horn quality, and it's important in particular for the claw horn diseases, so white line disease, sole ulcer, and sole hemorrhage. But it can also have an impact on the infectious diseases. So for example, in particular, if feet are very wet, then that's a high risk factor for digital dermatitis. So the only example photograph I've shown you here is a thin cow. So really important to watch out for these thin cows. If they're calving down thin, then the farmer is on the back foot already, if you excuse the pun. They are very likely to have a high lameness prevalence. Okay, looking at the third area, low forces on feet. So I said this is split up into two main areas. It's subdivided into having good cow comfort and good cow flow. So if you look at the cow comfort to start off with, that's really all about cubicle design, or mainly about cubicle design, cubicle comfort, but it's all about time budget. So time away from the beds, the amount of time that cows are spend milking, also the amount of space that's available to them in the housing, and having loose housing. So in other words, straw yards for cows at particular risk. So something that can be very useful to reduce lameness if the herd is suffering from sole ulcers and sole bruising, is to have the fresh calved cows on straw for the first 2 or 3 weeks of lactation, which means that they, well, two things. If they have a fresh cow group, which is a smaller group, then perhaps their milking times can be reduced, so they can be out of their pen into the milking parlor and back into their pen again very quickly to reduce the amount of time they're standing. They're forced to stand, but also the bedding that they're on is more comfortable, and it will increase their lying time in what is a very high risk period of time. So that would be some aspects of cow comfort, and I'll show you some photographs in a minute to illustrate that. The cow flow aspect is probably broader than you first might imagine. So when I ask farmers very often, what's important for cow flow for reducing white line disease, they often come up with the example, I must avoid sharp corners. I must avoid the sharp corners as cows are coming out of the parlor. And yeah, sure, that's a risk factor, but on most farms it's not the most important risk factor in terms of poor cow flow. So having narrow passageways, overcrowding, having dead-end passageways, all of those things are likely to be bigger risks for poor cow flow. In essence, the way to think about cow flow is if you walk into a cow shed and you close your eyes and just listen, if you can hear any scrabbling or scraping of feet, then you've got a problem, and it's likely to lead to white line disease. If the herd is very quiet and calm, then that's indicates better cow flow, and that's going to protect against white line disease. So as well as the environment and the housing, the other big aspect of cow flow is stockmanship. So if you have a herdsperson who shouts at the cows, uses sticks, and uses dogs are an absolute nightmare around cows. They just never be allowed. Dogs should never be allowed around a dairy herd, because they're a high risk for white line disease. Because wherever you've got rough stockmanship, rough handling of cows, then you've got poor cow flow, and that's a big risk for white line disease. And then also related to cow flow would be how the cows are managed at milking time in particular, because when they're milked, they're put into a tight space, and in the collection yard, it's a high risk time that happens twice a day for most farms, 3 times a day for 3 times a day milking herds for the cows, and how they're managed in the collection yard is a really important factor for reducing the risk of white line disease. So cow flow is quite an interesting subject in its own right. It's not just about tight bends and tight corners. It's about other aspects to do with housing design and also stockmanship. And of course, for that, cows at grazing, the tracks are very important, and the floor type are very, very important for white line disease. So cow comfort is particularly important for reducing sole hemorrhage and sole ulcers, and cow flow is particularly important for reducing white line disease. So to show some examples, this is the kind of thing I would like to see: wide passageways, not a lot of waiting cows, lots of space, comfortable cubicles. These cows, a lot of them are standing up because I've disturbed them, but when you first walk into this shed, it's a very nice designed shed, and the cows that are in the cubicles are lying down. So there's certain targets that we can use to measure cow comfort. And again, it's a subject area that I can't really go into in a lot of depth today because of time. A little bit like foot bathing, I don't have time to talk in detail about it, but measuring cow comfort or indicators of cow comfort would be an important part of the farm risk assessment to see how well the farm is performing in this area, and whether or not the changes that can be made, improvements to be made to improve cow comfort, improve lying times, and therefore reduce the risk of sole bruising and sole ulcer. So here we are. This is the same shed, but it has nice comfortable beds. I beg your pardon, it's not the same shed, it's a slightly different shed. Sorry, I'm just looking at a message. I thought Anna sent me a message. Beg your pardon. Sand beds are very good for cow comfort, and generally speaking, have improved lying times and reduced sole ulcers and sole bruising. Another example, yes, lots of cows lying down, nice sand beds. So these are kind of measures you can take is looking at the proportion of cows that are in contact with the cubicle that are actually lying down as opposed to standing up or standing half in or half out of a cubicle. And the target would be to have 85% of cows that are in any contact with the cubicle or free stall, I think you might call them free stalls, will be lying down. Another target or another measure is to look at what's called a waiting cow. So a waiting cow is any cow that is either isn't lying down in a cubicle, preferably chewing her cud, or standing and eating. So those are the two things that a cow should be doing, either standing and eating or lying down and chewing her cud. Cows will be moving around from A to B. Some cows will be showing estrus and so socializing, and some cows will be drinking water. But the target that I have for cows either standing, eating, or lying down chewing their cud is at least 85% of the herd at any one time. So in other words, no more than 15% of the herd should be what's called a waiting cow. And a waiting cow is called a waiting cow because she's usually waiting to do something. She's standing in a passageway waiting to do something. So this is a nice shed. It shows no waiting cows and very high proportion of cows that are lying down. As opposed to this shed, and you've now got a lot of cows that are standing half in or standing in a cubicle. So if we count up the cows, less than 85% of cows that are in contact with the cubicle will be lying down. There's more waiting cows. You've got a cow here who's waiting, and also on this pasture there's more cows that are waiting. And then other risks on this photograph would be the waves of slurry and the wetter floor that's associated with this floor that doesn't have a slatted channel down it, and it has a automatic scraper. So it isn't the most disastrous shed by any stretch of the imagination, but this herd does have more lame cows than the previous herd that I showed you, and a lot of that is due to the housing facility not being as good. And this is another example, is just looking a little bit more detail at cubicles. These bars down here are a poor design of cubicle because they interfere with what's called the bob space. The bob space is the space that's immediately in front of the cow's nose, and that's important to help cows get up and down without difficulty. And again, there's a very high proportion of cows that are in contact with the cubicles that are standing up or standing half in or half out of a cubicle. A low proportion of cows are lying down, and that would be due to the actual cubicle design. And also something to look out for is the space here. I hope you can see my arrow cursor moving. But this is a very, very small space between the head-to-head cubicles here, and that leads to cows lying diagonally because they don't like lying nose to nose. The space here between the brisket locators should be 1.8 meters or 6 feet if you work in feet. So 1.8 meters from here, whoops, to the other point, and it's too short. So that leads to poor cubicle lying times. And then this photograph, this is a disaster of a shed, a disaster of a farm, very, very high lameness prevalence. And it's down to very poor cubicles, very small amount of bedding, low lying times, high standing times. You see a lot of cows with hock sores and other sores on them, lesions. But the disaster about this farm is the farmer himself, who is rough with his cows. When I walked in this shed, they all scattered away from me. They're scared, and they're scared a lot of the time because the dog runs amongst them, yapping at their feet, and it's an absolute disaster from a lameness perspective. And that can be changed quite quickly and with little cost, with education and training for the farmer, and a greater understanding on how their behavior around the cows can influence lameness. So it's really, I find it very distressing when I see farms like this. I find it very, very distressing indeed, because this is the kind of thing that happens every day on so many farms, and the farmers are oblivious to what they're doing, but they're making their cows lame with their own behavior. Another example of what comes under the low forces on feet would be the track surface. So this is an example of a cow track, which is a poor design. It's also used for farm traffic. It's wet, and it's a disaster for white line disease, and this is a better track. And not only because the track itself is better designed, but because the cows are allowed to walk down the track without any pressure. They're allowed to walk at their own pace. And this track, it might be a good track, but it could be made at high risk if a herdsperson is following behind with a quad bike and a stick and a dog and putting pressure on the cows, causing them to bunch up, and that would be a high risk for white line disease. So that's just a bit of a flavour of what's involved in forces on cows' feet. And then the fourth one is EDPET, early detection, prompt effective treatment. So this means having a system to detect new cases early. So that means mobility scoring, in actual fact, for the vast majority of herds. It means an ability to respond quickly. So that means having set aside time to respond to lame cows and treat them early. And that's important to have good facilities, good equipment, and good training also. So this is important for all types of lameness. So some UK research, some quite nice UK research, has shown that if a farm just makes one intervention to reduce lameness, then early detection, prompt effective treatment is effective for all types of lameness. So even in a farm that has got poor cubicles, poor beds, poor environment in other ways, poor everything, if they just do early detection, prompt effective treatment, then they will reduce their lameness. So examples here, a nice crush, but also some good training. Using appropriate treatment, so using blocks and also non-steroidal anti-inflammatories for sole bruising and sole ulcers, and then having straw yards for a recovery yard. Okay, so that takes me to the end of that section, really, looking at the Healthy Feet program. And this is a summary of, again, using the images, a summary of what I've just been through. I'll answer the questions that I've received in the question box. Thank you, Anna, for pointing those out to me. So I've got two questions. First one from Isabella, and it says, what in your opinion is best for foot bathing, and would you use it for the entire year? So we're a little bit limited on what we've got available for foot bathing. In the UK, the most common foot bath is formaldehyde, formalin, but that's a carcinogen. It's not a nice chemical. I suspect it will be banned one day. The alternative is copper sulfate, and the evidence is that copper sulfate or formalin both work. Formalin kills you, and copper sulfate poisons the environment. So take your pick. It's not easy. There are other things. Paracetic acid has also been shown to work, but that is more prone to contamination, so it works less well when it becomes contaminated with feces. So copper sulfate is probably the best thing that I would advise. Acidified copper sulfate, acidifying it makes it go into solution and makes it more active, but it is expensive and it is an environmental pollutant. But what I certainly would not advise is ever using antibiotics in foot baths. Antibiotics in foot baths cannot be justified, and in the UK it's pretty much banned. People still do it, but they are really the tail enders, if you like. People should not use antibiotics for foot baths. It's a very irresponsible use of antibiotics, and there is no sound evidence to say that it has any improvement over non-antibiotic foot baths. And the next part of the question is, would you use it during the entire year? Is really case by case. So it depends on the farm. For a lot of farms, particularly housed herds, then yes, but herds that are not housed, then they maybe never need to foot bath, and it really depends on the level of digital dermatitis and farm management practices. So it has to be on a case by case basis in terms of the answer to that one, and likewise the frequency of foot bathing. Typically, it would need to be done at least twice a week, but some farms need to do it every day. Other farms, they don't need to do it very often at all. So it does depend on other factors. And then for Maria, the question I have is, what is my opinion about the different types of beds? So yeah, simple: sand, free stalls or cubicles. we use straw yards in the UK a little bit as well. Straw yards are fantastic for cow comfort, but really challenging to manage from a mastitis point of view. But well-designed, spacey cubicles or free stalls with deep sand bedding is the best. The devil's in the detail. There's different quality of sand, etc. But in short, deep sand bedding. If you can persuade your farmers to use deep sand bedding, then that's a big win for lameness reduction. Okay, so I said that developing the action plan is not the end, but it's the end of the beginning. I'm going to move on to the third section. If you're willing to stick with me, we've been going for an hour. Anna, do you want to just type in the box to say keep going or shorten? Can you just give me a bit of a heads up, Anna, on what you'd like me to do? And in the meantime, if anyone's got any questions on what we've discussed so far, then also please type that in the box. Okay, so Anna's saying keep going. So you've got a lot of patience, you guys in Portugal. I salute you. I think in the UK we end our webinars always after an hour because people I think they need to go and have another beer, I think. So yeah, we'll keep going then. So looking at putting lameness management into practice, and this is really about maximizing success and looking at the motivating change. Hold on, we've got another question. I'll just see what this is from Geronimo. Regarding cost efficiency. Okay. So regarding cost efficiency, is it still viable applying or rather ensuring that all these four factors? Really good question, Geronimo. And that is the skill again of facilitating the correct action plan. Of course, you could easily come up with a list of a whole load of things that the farmer should do, but you need to try and identify the key things that are going to have the maximum benefit, and perhaps just concentrate on a few things first and then move on to some other things later on. And remembering that early detection, prompt effective treatment is a really important factor for all farms, whatever the type of lameness. It's always good to focus on that. I think it depends for me on what's already happening in that department, in that area first. So for example, if the farm does not have an early detection protocol in place, and like I said, in essence, that means doing herd mobility scoring. It doesn't need to be an outside person. So sorry, I need to go back a stage. When I talked about doing an independent herd mobility score to measure progress, that's really important that that's an independent person, someone who's not from the farm, who comes in and does an objective once every 3 months score to see what the lameness level is. That's to measure lameness, but once every 3 months is not often enough to use as a tool for early detection. So a good starting point for many farms, if they're not already doing it, is to train someone on the farm to mobility score the cows and use that probably fortnightly, every 2 weeks is quite practical for most farms, as a method to detect the score to cows. Because if that isn't happening already, it needs to happen. And that can be just the starting point for a lot of farmers, just putting that into place so they can detect their score 2 cows. They can therefore treat their score 2 cows, and they're treating the right cows now. They're not waiting until the cows are score 3 and have a very reduced chance of recovery. They're treating the cows at a very early stage. And if they just do that one intervention, early detection, using mobility scoring on a fortnightly basis, then and then obviously treating those cows, then their lameness will reduce. How lucrative would that be? For most farms, it's incredibly lucrative, because even if they're paying for an outside trimmer, they'll get their money back in spades. Sorry, that's an expression you might not understand. So they would get their money back way above their investment for doing the early intervention. And actually, if you think about this, most farms that do an early intervention, once they have got into it, so they've been doing it for 6 months, they're treating no more lame cows than they were previously. They're just treating the right lame cows, because they're treating the cows at a score 2 stage at an early stage rather than waiting for them to be score 3 cows. And because these cows recover quicker and they have less relapses, in actual fact, the number of cows that they need to treat will reduce over time because they're not having to do repeat treatments. So it's quite hard to get farmers, get their heads around it and to get that behavior change, to get them on that journey of doing it. But that's a really important starting point. So, John, I hope that answers your question. What in terms of prioritizing your actions? But yes, EdPet would be a good place to start. Okay, so I'm going to share with you some results of a project that I was involved with a few years ago. It's called the Northwest Mobility Project, Northwest as in Northwest England. We took the Healthy Feet program, delivered by, I think there was 14 different mobility mentors, all of them vets in this case, in different vet practices. And we asked these 14 mobility mentors to work with some farms who wanted to do the Healthy Feet program. So that was 25 farms. So on average, each mobility mentor did 2 farms each, but some did more and some did only 1 farm. So we had 25 farms that were doing the Healthy Feet program with a range of different mobility mentor vets in a range of different vet practices. We matched those 25 farms with 20 farms or 21 farms that were control farms, and these farms they had no Healthy Feet program, but the farmers were allowed to do what they would normally do to prevent lameness. And that's right. If you follow most farms, they will always introduce new things each year. It's not often that a farm won't try something new. A lot of farms will be trying new things all the time. So we didn't stop them trying new things, whether that would be changing their foot bath solution or changing their foot bath frequency or changing their foot trimming. You know, these farms, they were just control farms in the sense that they didn't have the Healthy Feet program. Now, all of the herds, so all of the 45 herds that we recruited, the 25 doing the Healthy Feet program, the 21 that weren't, sorry, that comes to 46. We probably had 1 farm drop out somewhere, whatever. They all had an independent whole herd mobility score every 3 months. However, because we learned from a previous project that had done something similar, that if you share the mobility scores with the control farms, it motivates them to make more changes. We didn't tell the control farms what their herd mobility scores were. We just did a mobility score and the results were blind to those farms. However, the farms that were doing the Health Feet program, they did get to know what their mobility scores were. And actually it was part of the Health Feet program because we recommend doing a herd mobility score every 3 months as part of the Health Feet program. So that was the project. It wasn't a perfect trial by any means because these farms were not randomly assigned to different groups. They were what's called a convenience sample. So these were farms that had volunteered to do the Healthy Feet program, and we matched them with just 21 random farms that weren't doing the Healthy Feet program. So it wasn't what's the word? A case control study in that sense. It was just a convenience sample of farms. Now, what we found is over the year, the farms that did the Health Feed program reduced their lameness by an average of 22%, which was great. The farms that didn't do the Health Feed program, they had no overall reduction in lameness. Now, that's not to say that some of the farms that didn't do the Health Feed program didn't improve with the lameness. Some did, but some got worse. But on average, when we pull that group together, they had no overall reduction in lameness. And by the way, the lameness at the start of the program, the start of the project for both groups of farms was 32%. And at the end of the project, it was, I think, 33% for the farms that didn't do the Healthy Feet program. So actually they got slightly worse, but it wasn't significant. Overall, the farms that didn't do the Healthy Feet program, their lameness stayed roughly the same. And that's kind of obvious in a way because if farms were improving all the time, we would be seeing a reduction in lameness year on year without any intervention. And we don't see that. We see that, yes, some farms get good years, some farms get bad years, but overall, lameness in the UK is staying pretty constant at around about 30%. So the farms that did the Health Feet program, again, some did get better, a lot better. Some got a little bit better. Some stayed the same. And the odd one actually went worse. So not every farm improved their lameness. But again, if we took all 25 farms doing the healthy feed program, we put them together as one group, then overall they reduced their lameness by an average of 22%. So you might say, well, that's not a massive reduction. So I don't know what 22% of 32% is, but it went from, what was that? I think it went from 32% at the start to round about, I can't do the sums in my head, but around about 22% or something at the end of the 1 year on average. Now, all of the farms made some changes to try and reduce lameness, whether they were enrolled on a health feed program or not. We found the other thing that we found was that the average cost benefit for the farms doing the health feed program was estimated to be £6.50 for every £1 they invested. So that includes the money they spent. They had to pay for the health feed program. It wasn't given to them free of charge. And typically it cost them around about £1,500 for the full year for doing the independent mobility schools and having the vet time and the follow-up and so on. And in addition to that, then their farms had to spend some money, usually, to make some changes, whether that be, I don't know, increasing their foot trimming frequency initially, or spending a little bit more on foot bathing, or building new foot baths. We calculated what was spent during the year and the cost benefit over what they spent. And we estimated that the cost benefit was £6.50 for every £1 that they invested. Now, we found all sorts of interesting things, and I'll just go through some of them, but come to the main one. So we found that the farms that did a healthy feed program, while all farms did do something, every farm did something that was there to try and reduce lameness during the year, something new, then the planned farms made twice the number of changes compared to the other farms. And previous studies to ours had found that the more interventions that are made, the more that lameness is reduced. So I think on average, the control farms made, just under 4 changes, and the control farms made nearly 8 changes. So these are new things. So let's look at what those sorts of things were. These were the top 6 changes that were made. So the main one, that by almost 90% of the farms doing the healthy feed program, was introducing regular mobility scoring. So this is in addition, to the mobility scoring that's happening every 3 months by the independent scorer. This is using mobility scoring as a tool for helping early identification of lame cows. So this is using mobility scoring within the farm team to identify lame cows early. So that was the main or the most common intervention by nearly 90% of farms. The second most common change that the farmers made was having some training on foot trimming, which often happens when you do the healthy feed program. You discuss with the farmers about treatment and that sort of thing, and often a farmer will say to themselves, "Well, I probably need to do a refresher course on foot trimming." They realise themselves that they need to improve their skills. Then we found that the third most common action was cubicle modifications to try and increase lying times, concrete repairs or changes, repairing concrete on the yards, or grooving some areas, high-risk areas. I think that included rubber as well, putting some rubber down on some high-risk areas. Some farms did that. And then the fifth most common intervention was improving the footbath procedure, and then the sixth one was some change to improve cow flow, and that was often around behavior change, around how cows were handled in the collection yard. So as part of the healthy feed program, that's quite often discussed, particularly if farmers have got a white Lyme disease problem. There's sometimes some simple things that can be done around just changing the layouts of gates, not using the backing gate very aggressively, using it in a different way to reduce risks of shearing forces on the cow's feet in the collection yard. So they were the top 6 actions. What we wanted to do, though, is we wanted to find out whether there was one particular action which was associated with the herds that had the least lameness at the end of the year. So we thought, well, what's most important here? A little bit is, it refers back to Geronimo's question a little bit, is, if we knew what the most important interventions were, then we just get all farms to do that. So it might be, increased foot bathing or increased foot trimming or whatever. And we couldn't find any link there at all. We couldn't find a link. Some farms were doing foot trimming 3 times a year. Some farmers were doing foot trimming for their um, uh, cows early lactation. So let's say let's say a day 50 or day 60 trim. But there wasn't nothing we could find. Okay, it wasn't a very big sample size, but there was nothing we could find that had a significant bearing on lameness. There was no single intervention that we could find, and perhaps the reason for that is that every farm is different, and the intervention for every farm needs to be different because the risks are different. And I suppose that maybe supports the approach of the Healthy Feet program in that it is a bespoke action plan that is tailored to the farm. And so perhaps our findings reinforce that this is the right approach to do a personal bespoke program on a farm by farm basis, rather than just saying you do this, this, and this, and it will work for every farm. However, as part of the project, we did a lot of asking of questions, and we wanted to find out what farmers' attitudes were towards lameness. And something definitely cropped up here, which we weren't expecting, but it was a strong finding. So it was to do with what we defined as personal barriers. So one of the questions we asked was to the farmers, what are your personal barriers for reducing lameness? And this question was asked across all of the farms, whether they're doing the Healthy Feet program or not doing the Healthy Feet program. And when we analysed the result between the farms that had the least lameness and the most lameness, we're looking at the top 25% quartile and the bottom 25% quartile. So we're splitting just those, what would it be, 10 farms in each. We found this difference, which was quite striking. So maybe not unsurprisingly, farmers identified their most common barrier for trying to reduce lameness was not having enough time. So, a lot of farmers say, well, I know what I need to do, but I just don't have enough time to do it. So this was in the farms that had the least lameness, then it was about 2/3, but the farms that had the most lameness, then 90% of them had identified that not enough time was a barrier. And there's not that much difference between those two groups. But look at the scores for the other aspects. There was a strong difference between farms that had the least lameness in terms of their personal barrier score. So in other words, if a farm had less lameness, they were less likely to come up with reasons why they couldn't do more. So we turned that into a personal barrier score. So we found that the farms that had the least lameness had a personal barrier score of 20%. So we basically scored them out of 24. They got 4.9 out of 24, 20%. Whereas the farms that had the most lameness, they had a personal barrier score of 61%, and the average for all farms was 30%. So we found that how we summarized that was that farmers that had a more can-do attitude, I hope that can-do attitude, I hope that translates okay. I hope you understand my English there. They had less lameness. So the next question was, how can we, as mobility mentors, how can we get more farmers to have this can-do attitude? Or can we, in fact, change the attitude of farmers? Can we give them more confidence that they can reduce lameness? And therefore, they will reduce lameness. Or is it just that a farmer, you've got different personality types. There are some people who just shrug their shoulders and say, well, I can't do anything about it. And there are some that are more proactive and, will find the solutions to their own problems. Well, our research didn't give us an answer to that, because it would mean going back again and seeing whether we could change the personal barrier score with the intervention. And we weren't able to look at that. But we did investigate other aspects of social science to see whether we could draw some parallels, and we did. We found that this is quite a well-researched area, actually. It's something called locus of control. So the question that you might ask is, do you believe, as an individual, ask yourself this question yourselves, is do you believe that your fate is controlled by internal person variables or by external environmental variables? Now, a philosopher called Julian Rotter was someone who talked about this, and he said that people who have a strong internal locus of control they work harder to obtain a goal and believe that they can control the outcome in a specific situation. And that results in those people being more successful. So another way to describe that internal locus of control is something called self-efficacy. If you've come across that term, having a strong self-efficacy, I'll illustrate it with an example with a farmer. So if a farmer thinks that their lameness is because the weather's been bad, they're more likely to think that they have a problem and it's not their fault, it's out of their control. Maybe fault is not the right word, because it's not about blame, it's something that's out of their control. Whereas a farmer that has less lameness is more likely to understand that they themselves are in control of their lameness. So we looked at a method that we could use to try and put that into practice, and we came across this model here, where the first thing that we must do with farmers is give them awareness of the problem. Then we must help them accept responsibility for that problem and build their perceptions of options, and that will help them to make a choice. They can put in place something called experimental behavior, and then that turns into habitual behavior. So looking at the steps in terms of the Healthy Feet program, the first thing to do is to raise awareness of the problem, and answering the question, what is my herd mobility score, is a very good starting place. Then accepting responsibility is helping the farmer understand, I'm in control of this. This is something that I can change. It isn't dependent on the weather. It isn't dependent on the nutrition. It isn't dependent on stuff that I can't control. It isn't dependent on milk price. It's something they can control. Then the program itself, the plan, is all about looking at what options have I got then? What can I do? This is developing the plan. Once the plan is developed, it's helping the farmer put that plan into action. So it's saying, the farmer needs to say to themselves, I really now intend to make some changes. And then sticking at it, because changes usually don't work first time round. So the next thing is to say, I'm going to make this work, and then having a successful outcome, because the change is embedded in the new behavior. And this is described in Asgen's theory of planned behavior. So I'm going to explain this. It's something that we refer to a lot in the Healthy Feet program, and we use it a lot in the training of the mobility mentors. So Asgen's theory of planned behavior is this. And think about this yourself, because you can think about something that perhaps you are wanting to do. And I'll talk through it with an example of giving up smoking. So if you wanted to give up smoking, you need to have a behavior change. To have a behavior change, you need to intend to have a behavior change. And there are 3 building blocks for that intention. And this is Asgen's theory. The first part of the building block, the first thing that you must have, is a behavioral belief, which leads to an attitude towards that behavior. And I'll explain what this means. So in terms of giving up smoking, if you don't believe that smoking is bad for you, or if you don't believe that giving up smoking is going to give you any improvements to your quality of life, whether that make you live longer, or make you feel more active, or more fit, or not be out of breath, or perhaps give you a better chance of surviving coronavirus if we get it. If you don't believe that smoking is bad for you, then it's a fairly important reason why you're not going to give up smoking. So the first thing is, you've got to believe that smoking's bad for you. Let's look at this in terms of lameness. If a farmer doesn't believe they have a lameness problem, if they don't believe or understand that lameness is costing them money, and don't forget, for an average 200 cow herd in the UK, that is €58,500 every year. If a farmer doesn't believe that, then it's a fairly important thing that's missing in order for them to intend to reduce lameness. So that's the first thing. The second thing is normative belief and a subjective norm. And again, I'll explain what that means. This is basically describing that we as human beings are all herd animals. We all like to copy our neighbors. So smoking is a really good example here. I used to smoke. I used to enjoy smoking. I used to smoke as a student, and a lot of my friends smoked, and it was a very social thing to do. And that was part of the reason why I smoked. I don't smoke, and I gave up quite a long time ago because I found that my friends had stopped smoking, so I had no one to smoke with. It became an antisocial behavior. And so that's been a big factor in driving down smoking in our country, is the fact that fewer people smoke, and so it becomes socially less acceptable. So in terms of with lameness, if farms compare themselves to their neighbor and they think, oh well, you know, my neighbor's got more lame cows than I have, then they're less likely to reduce their own lameness. Whereas if they look to their neighbors and they can see their neighbors are doing a better job than they are in terms of lameness, then they will reduce lameness. So basically, it's how a farmer believes their lameness to be compared to their mates, compared to their people they compare themselves with. So that's what the subjective norm is, a normative belief. So if it becomes socially unacceptable to have lame cows for whatever reason, it's a big driver. And then the third piece of the jigsaw is something called a control belief, or a perceived behavioral control. And this is a little bit like the self-efficacy that I talked about before. So it's really it's the farmer having some tools in order to help them reduce the lameness. And this is something that you can definitely, you can, as a vet or a mobility mentor, you can help your farmer with each three of these elements, but it's something that you can definitely help with. So let's take the example of giving up smoking. I might believe that smoking is bad for me. I might now understand that it's a bit antisocial and no one else smokes or none of my friends smoke. But if I believe that I am someone with an addictive personality, or I think, well, I tried to give up smoking last year and I failed, so I can't do it, then I don't have this third piece of the jigsaw. I don't have a control belief. I don't have a self-efficacy. However, there are tools always to help us do things. So for giving up smoking, I could say, well, okay, I tried last year, but I didn't try nicotine patches, or I didn't try nicotine gum, or I didn't try having counseling or therapy or whatever. You know, these are tools to help us do something. So in terms of lameness, a farmer might understand that lameness is bad for them and costing their business. They might understand that it's desirable to have fewer lame cows, and certainly that's the way that society would like them to be. But if they don't understand what they've got to do to achieve that aim, then they're not going to make the behavior change. And that's what the Healthy Feet program is all about, is trying to build these three building blocks. It's not just about giving them the tools, but it's also about helping farmers understand why lameness is important and what it's costing them, understand why it's important from a social point of view and a social acceptance point of view, and acceptance from the dairy consumer. And then it's about understanding what they can do, what actual things they can put in place to reduce lameness. And we can build self-efficacy by starting with small things and celebrating small successes. Because once a farmer has demonstrated or built up their own confidence in a small success by doing one thing that's worked, then they're more likely to have a better self-belief to do more things that work. So that's an important aspect of the Healthy Feet program. And actually, when we do the training for the mobility mentors, it's a 2-day training program, 2-day training course. Yes, some of it is about technicalities about lameness. You know, we do a little bit of theory on what causes lameness, but actually the most part of the training is developing these skills to work with farmers in a particular way, using Atkisson's theory of planned behavior to achieve the changes that farmers need to make to reduce lameness. And that's why we call them mobility mentors. A mentor is a trusted and experienced advisor, a guide who helps find and develop the right solutions. So that's what I'm going to finish with. Just a little bit of a plea, really. I guess a lot of, I think that a lot or most of you are students, so you're starting out in your veterinary career, and I kind of implore you to go out there and develop your own coaching skills in order to build your client's capacity for self-help. And it's a really fascinating, it's part of my job I enjoy the most, is working with people. I became a vet because I liked working with animals, and I still do. But the older I get and the more I do this, the more I enjoy working with people and helping people help themselves. So something I'll leave you with is learn to become a thinking partner. And by that, I mean, as a vet, it's an easy trap to fall into, to believe that you, with all your training, your 5 years at university, all your learning, it's easy to believe that you are the person who has the answers. And actually, it's more effective to help your farmer think of their answers themselves. And the strength that you have as a vet being effective is to become a thinking partner. And that means that you think with your farmer. You don't think for your farmer. You don't give advice, but you coach your farmer and lead them to think of their own solutions. Farmers are incredibly resilient, resourceful, intelligent people, as we all are. And by learning to work with them and by asking lots of questions and listening, it's a key bit, is listening, and be attentive with the listening, then you'll help the farmer develop their own thoughts and therefore their own solutions, and they're more likely to put those into place than any solutions which you might offer as an external person. So become a thinking partner. Okay, there are references and further reading on all of this. How do I share this? Because you can't. I've made a recording of this webinar, so Anna, you might be able to record. You might be able to send some of this stuff around if I give you the recording. I'm going to point you in the direction of a book which I helped write, so I'm bound to be biased, but point in the direction of this book, Bovine Surgery and Lameness, 3rd edition. It's been around for a long time. The 1st edition was written, I think, in 1980. The 3rd edition is updated, so a third of this book is on lameness. It also includes surgery, but a third of this book is on lameness, which is the part that I spent the most time writing, and it has loads of stuff in there. So I'm going to point you towards that because I think it's a good book, and I hope you enjoy it because it's also relatively cheap as a good resource. And that leads me to the end. So I'll just see what questions we have, and I'm happy to answer anything and have a discussion. Anna, I'm going to unmute you as well because you can perhaps come in and sort of give some comments as well. Oops. I'm going to hold on. Right. So there we are. You've got just me on your screen now. Let's see what the question is. So I've got one from Sandra here. Anna, I did try and unmute you, but it didn't work. Maybe you need to unmute yourself. From Sandra, two questions. Have you ever seen or applied a prosthesis to a cow that had to amputate the limb or part of the limb? No, is the answer to that. Have I applied a prosthesis? No, I've done lots and lots of digit amputations. And if you want to learn more about the surgery, actually that book I just pointed out to you, Bovine Surgery and Lameness, has got loads of stuff on there of different alternatives apart from just digit amputation, how to deal with hard to treat lesions. But no, I've not used a limb prosthesis. And the second part of the question is, have you ever compared cows walking with lameness versus healthy, for example, with pressure platforms? Yeah, I haven't personally, but there has been lots of work. So, sorry, the question is, if you can't read the question, is have you ever compared cows walking with lameness versus healthy, for example, using pressure platforms, or measure the DFD? I'm not sure DFD is. There are other people who have done all sorts of work on trying to identify lame cows. It's a really interesting research area because relying on a human being to do mobility scoring is a little bit flawed in many respects. It's not ideal. And if there was a electronic gadget which could identify lame cows easily and reliably, that would be really useful. Here we are. It's the measure between the limbs while walking. Right. There is a pressure plate system made by Bowmatic, which is an American company, and it's called Step Metrics. It has limited success. in identifying lame cows. It's very expensive to install, and it's not very specific. So it identifies a lot of cows that walk with a strange gait for on a particular day for whatever reason, and so it hasn't proved to be that useful from that point of view. I'm not aware of anything that is measuring the stride length as such, but there may be stuff that does that. I am aware of work on pedometers in particular, and I think there's some promise in some of the pedometers in detecting lame cows early. So pedometers can be used to measure steps, which, okay, there may be a relationship between step count and lameness. But more importantly, some of them can measure lying time very accurately, because if they have so the pedometers will have an accelerometer on them, but they also have a gyroscope, so it will tell whether a cow is upright or horizontal, and so very accurately it can measure lying time because it's horizontal, and it can also measure the length of the lying bouts. So lame cows, when they go lame, some of them lie down for longer and some lie down for less time. It depends on the cow and it depends on the bedding type. So cows with comfortable bedding, such as sand cubicles, if they're lame, they often lie down for more time, and on less comfortable bedding, if they're lame, they lie down for less time. And that might be because getting up and down is difficult when they're lame. So lying time on its own doesn't seem to be a very reliable measure for lameness. But when you combine it with lying bouts, in other words, the number of times a cow will lie down in a 24-hour period, it then starts becoming useful. And so there is a system in the UK called Cow Alert, made by a company called Ice Robotics. And they have a pedometer which takes three measures, and that then goes into an algorithm to detect lame cows early. So it will do a step count, it measures total lying time, and it measures lying bouts. So in other words, the number of times a cow will go, lie down, and then stand up again in a 24-hour period. And lying bouts is associated with lameness in the sense that cows that are lame have fewer lying bouts. They might be longer bouts, but they have fewer. Whereas a non-lame cow would normally get up and down about 8 or 9 times a day and have a total lying time of about 12 hours. So I hope that answers your question there, Sandra. Okay, and yeah, you say you like the background. Thank you very much for that. I did actually have some other backgrounds. I was gonna put on another one for you. Now we got to the end, which sort of summarizes perhaps a little bit of where we're at. Here we are. So it's now night time. Do we have any other questions? Because if not, then I thank you very much for your attention. I wish you a very happy evening. And I wish you lots of luck and stay safe in these very strange times with the coronavirus. I'm sure you're having a very difficult time of it in Portugal. We certainly are in the UK. It's very difficult for lots and lots of reasons. So stay safe, everyone, and thank you very much. Enjoy the rest of your evening.